I give the floor now to Mr. Daniel Burka, please. Have the floor, sir.
Thank you very much. I'm also in isolation in London, so I look forward to the day I can get a pint with David. Thank you very much for having me today. So before coming to Resolve to Save Lives, which is a not-for-profit based in New York, I came there to work with former US CDC Director Dr. Tom Frieden. Before that, I worked at Google Ventures, which is the venture capital arm of Google. So it might surprise you that I'm actually the most optimistic about the least fancy innovations in technology. To me, the most exciting innovations that are coming out of COVID-19 are the really good ideas that we've known about for a long time that have always been just on the brink of being widely accepted, and now they've been accelerated because of the pandemic. These aren't the novel breakthroughs and the ultra high-tech solutions that the press breathlessly reports. They don't have catchy phrases like machine learning, AI, IoT, or blockchain associated with them. So what am I talking about? I'm really excited about things like telemedicine. Even in America, telemedicine's been a good idea whose time was always just around the corner. But because of clinical inertia and regulatory hesitance, telemedicine's been just about to break through. The technology's not that exciting anymore. We've had video conferencing software and we've had EMRs for ages. But the tech itself is an enabler of the innovation in healthcare delivery, which is the big change. So I'm excited particularly about telemedicine for the treatment of chronic diseases like hypertension and diabetes. In places like India, where I do a lot of work, patients travel really long distances to wait in long lines for treatment for hypertension, which means that patients have low adherence, and with the current pandemic, at-risk patients will be exposed to infection in the hospital. In response to COVID, the government of India has fast-tracked some really smart laws that clearly spell out how telemedicine can be used. Likewise, in America, you've seen rules being relaxed or quickly codified. To any of the tech geeks here, the innovation sounds almost silly. In India, we're able to use WhatsApp Messenger combined with this really lightweight electronic medical record that we build, which you can learn about more at simple.org. But it enables you to move hypertension care right down to the community level, even at rural villages in India, which is a really big deal. Even after COVID, this has the potential to transform chronic disease care so patients can be treated effectively and safely close to their homes on a much more regular cadence. And it empowers community health workers to treat them. The other area where I see really practical innovation is in contact tracing. In the US, Resolve to Save Lives is involved in helping New York State and other jurisdictions to scale traditional contact tracing. This is people on the phone calling index cases and soliciting their contacts. I know that Google and Apple and high-tech Bluetooth and GPS tracking solutions around proximity tracing have been grabbing the headlines, and everyone in Silicon Valley thinks that novel solutions are the answer. But there are no tech silver bullets here. Tech is not going to ride to the rescue with some magic technology. What we need is a huge workforce scale-up to increase traditional contact tracing in the US to allow society to open again. It's a huge public health challenge, it's a huge training challenge, and both need good, pragmatic technology innovation behind them. Again, the most innovative solutions here aren't particularly high-tech. They're about combining things like good CRM software, good case management solutions and data solutions, and a few new components to increase the efficiency and efficacy of contact tracing. So we're working with New York State and Bloomberg Philanthropies to develop this combination of tools to scale contact tracing workforce significantly, at the same time as putting simple apps in citizens' hands to explicitly share their contacts with the health department. Other than some efforts like the WHO's GODEP project and some companies like Demaji, critical contact tracing has gotten very little attention from the tech innovation until just the last few months. That's really tragic, but it's hopeful that modern tech and innovative solutions in healthcare delivery are now being deployed that will strengthen contact tracing for COVID, but also prepare us for future pandemics all over the world. In summary, I think we all do a disservice if we think of innovation in tech as only the latest cutting-edge solutions. For instance, every time I tell my Silicon Valley friends that I work on a huge hypertension program with great teams in India, Bangladesh, and Ethiopia, My friends excitedly tell me how they'd employ the latest sensors and wearables to address the challenge. These kinds of solutions are really nifty for wealthy Californians. But the world doesn't need another smartwatch to cure hypertension. It needs a strong public health program, well-trained healthcare workers, and just enough technology behind them to help them succeed. There's a huge world of challenges that need pragmatic, simple innovation done at scale that can save millions of lives. Thank you.
Thank you very much, Daniel, for this view, very down to earth, and putting in perspective the role of innovation and the role of, let's say, frontier technologies in solving this pandemic and the future.